Good afternoon and welcome to this PRCA webinar, which today is diving into an incredibly important topic, men's mental health, particularly as it comes towards the end of Men's Mental Health Month. It's a topic that isn't often discussed enough. If you are joining us live today, and if you would like to pose a question to our panelists, please feel free to post that question and know that you should feel comfortable because we're all here to talk about this. And talking of talking, I'm delighted to be joined by three people who are far smarter than I. Dr. Girish Banwai, who is psychiatrist, specialist psychiatrist at Medcare, Camali Mental Health Clinic. Dr. Moamen Amin Abdelrahim, who is consultant urologist at Medcare Hospital in Sharjah, and Adil Hussain, who is a men's coach, a lifestyle and mindset coach, and a motivational speaker, and has tremendous red braces today. Thank you all for joining us today.
Cool.
So when I posted about this event on LinkedIn, I said that my father and I had never had a conversation about mental health in the 68 years he was with us. And I just wanted to explain a little bit more about that. To give you a bit more about my father, he came from one of the poorest places in the UK, and he rose to win scholarships to fine schools. He played sports for his county. He owned a company that had a global footprint. He was the most fearless, resilient man I have ever met. His motto in life was Invictus Manio, which means I remain undefeated. And so he did for all of his life until up about 2 years ago, he lost control of something and it killed him. And it was very much a mental health issue. And since then, I've been asking questions about my own mental health, taking a look at my life, and it's really opened the door in a conversation that I've had to have with myself. So Dr. Girish, I'm going to start with you and ask, why is it so hard for us men to talk about this? The figures we know say that 1 in 4 people statistically will be impacted by mental health. Here in the UAE, it's actually 1 in 3. So why can't we talk about this?
Well, I think this is something that all of you would agree with, and everyone that's present in the webinar would agree with, that men, they're not encouraged to express emotionally. It comes from a cultural space, it comes from a societal space where men have to be men, they have to be strong. You know, that's how they're grown. Boys don't cry, boys don't express emotion. So this is the conditioning that they grow up with, and this stays with them. So showing vulnerability comes across as a sign of not being man enough, not being masculine enough. So this idea of masculinity that we identify with as a society, all men, expressing vulnerability, expressing that, oh, I'm not feeling well, I'm feeling emotionally low, I'm depressed, I'm anxious, is clearly seen as a sign of weakness. It is seen as not a problem, it's seen as a moral failure. It's seen as a failure to not be able to help yourself. So a man has to be a provider, a rescuer. They solve other people's problems. They don't come up with their own problems. So I think that is at the root of why men would be so shy, so embarrassed to come out in the open, except that they have a mental health problem, just because of the prevalent stigma around speaking about these issues.
Adil, I mean, you're a men's coach, you're a lifestyle and a mindset coach and a motivational speaker. How often do you come up against this? I mean, and how do you kind of tackle that with the men that you work with?
So this is pretty much all I do, right? So the men that I tend to work with, they come to me because something just doesn't feel quite right. And the only way that I feel that I've been able to actually make an impact at the beginning to even get men to come and speak with me is by me being vulnerable myself. So all over my Instagram and my LinkedIn, I've been sharing my stories, you know, videos of me speaking about times when I felt not enough, overwhelmed, stressed. I recently put a video up about me having an anxiety attack, which is my first ever anxiety attack that I didn't really know what to expect. And I'm finding that men will talk to me because they can see that there's some safety here, there's some trust. But amongst their friends and their peers, their family, they're sometimes telling me things for the first time that they've never expressed out loud to anyone else, you know? And the key thing that I'm trying to do is just at least get the conversation started. That's the beginning. I mean, that's like my tagline. Let's get the conversation started. Because I find that men are facing a lot, experiencing a lot, especially men in Dubai. Think about it, 85% or around that figure of people in Dubai are expats, and they're coming over here, and a lot of them are men, trying to support their families, make a name for themselves, or do something to be successful, right? And with that comes a lot of pressure, a lot of stress. Stress of supporting the family. They're alone. They're isolated. So I also run a men's circle, and every week I get men that come to me from my meetup page, and a lot of them join because they're actually, first of all, they're alone. They're lonely. They don't have any friends, so they have no one to speak to anyway. Yeah. And then they realize that, oh, this is the men's circle where we talk about stuff. And then they might be a little bit hesitant, but when they see that there's safety, they're more likely to open up. So the key thing that I think is missing is men need to understand that there's safety, or there can be safety when speaking with other men. But I find that we're not really encouraged to do that from a young age. It's more keeping things to yourself, stay humble, crack on with things, don't cry, just how the Dr. Girish was talking. We're not really encouraged to express those emotions and feelings. So a lot of men don't actually understand what those emotions are. And then they face things that are coming up. And instead of facing them, they go away and they seek comfort in coping mechanisms that aren't necessarily healthy for them and more detrimental to their lives. So I might be talking to a man who drinks every evening, and my questions to him are, why? And what are you suppressing? Or, what are you really feeling? It's very difficult to have that conversation at the outset, but over time that becomes easier. So I'm keen to understand from you, have you faced this, coping mechanisms and suppressing your emotions rather than actually letting them out?
I think my wife would tell you that I could be accused of coping mechanism a bit too much at times, and that is a work in progress. I wanted to stay with you, Moamen. I will come to you in a second, I promise you. I just want to stay with you for 1 minute, Adil, because you raised two really interesting points for me. Amongst all, it's all brilliant. Firstly, you talk about, obviously you've got guys who are coming over here and their husbands and their fathers. And Dubai has an underlying stressor, because if you fall and if you fail, it impacts your wife and your children's ability to stay here, because your existence in this part of the world is often linked to your job visa. So does that create an extra layer of stress, which is like, we can't fail because other people are relying on us? That point of view. And I also wanted, just for anyone that is tuning in either live or who watches this on the catch up afterwards, you said you had an anxiety attack, your first anxiety attack. Could you talk us through, if that's okay, like what was happening to you? So if anyone's watching this, they'll go, I'm having an anxiety attack, basically, so they know the symptoms.
Yeah, so I'll go into that first. So I've only known about anxiety attacks based on friends and family that have told me they've had one, and even some of the clients that I've worked with, but I had never really experienced it before in my life. And what happened, I could feel, I guess in hindsight, I could feel the symptoms or the building up of this anxiety attack coming. And that was really just feeling quite overwhelmed, that feeling of being just feeling a bit stressed, a bit heavy. I was feeling quite tired very, very often, very frequently. I would stress about the things that were coming up during the week and not being able to sleep. I was really struggling to sleep at nighttime, or at least straight away. I found myself procrastinating during the day, not being able to focus on the things that I wanted to focus on. But when the anxiety attack happened, I was literally sitting at my table. Everything was fine. I went to go lie down and go to sleep, and I was overwhelmed and overcome with this feeling that I wanted to get out of my skin. I can't really explain. I just wanted to leave my body. I wanted to get out of my body. I felt uncomfortable. My heart was racing more than I've ever felt in my entire life. I was sweating, but I was hyper aware at the same time. So I could sense and feel everything that was going on around me. Every hair on my body, I could feel everything. And my partner was with me, and luckily, she was trying to calm me down with some breath work, just to breathe in slowly, breathe out slowly, literally just keep cycling that. And I remember feeling at that moment a little bit ashamed. I felt a little bit ashamed that she was there trying to calm me down, and I'm lying there in this curled up in a ball, thinking to myself, what the hell, what's going on? How am I this? I'm a men's coach, right? So first of all, I had this feeling. I'm a guy out here supporting so many men, so many people that I work with. How can this be happening to me? How can this be happening to me? But the truth is, it happens, and it can happen to anyone. And it was a real kind of eye opener for me. And I took 2 weeks off. I took 2 weeks off and just didn't look at anything work related. I bought all the Harry Potter books, and I've just been spending the last couple of weeks reading Harry Potter, taking my time, not waking up early, just going with the flow. And I guess a message out of this is to just encourage balance, take time off. I work for myself. So I left the corporate world and I work for myself. And you think you'd have more time, but actually I work every day. You know, I work every day. And it encouraged me to take my weekends at least.
I mean, I think that's important. And Moamen, you'll be seeing this from basically you're on the sort of the coalface of all of this. Right now, we're in the middle of an economic bounce back. I mean, like Dubai is always a busy place. You know, it's an ambitious, always on culture. There's always economic activity happening. But right now, I think Dubai and the UAE is busier than it's been in forever because, you know, there's an economic bounce back. There's so much activity out there. How important is it within all of that? Because yes, we need to lean into the economic opportunity because the work's there and we need to lean into it. But how important within all of that is it to not get lost in that and to make time to look after ourselves and actually recognize the signals and the symptoms of burnout and stress? Dr. Moamen, I'll come to you on that one.
Yeah. Actually, now with the stress, I'm just need to add something for Dr. Girish and Adel comments. People usually, or men usually, they deny some pains. They think that they cannot complain like any other genders, like female, and we can face that with the sexual dysfunction. Usually, men deny the sexual dysfunction. And they still complaining of that for many years, and they're feeling the pain of that, and they don't complain, they don't go to the doctor, they don't ask for help with that, because they think that they don't have to complain against the sexual dysfunction. Nowadays, with the stress happened in the last 2 years, this issues increasing frequently, and you can see a lot of patients complaining from that. Usually we have to ask the patients, and usually they will not gonna ask us for help. Usually we have to give them leading question. Do you have any problem with sexual dysfunction? Do you have any stress of doing sex? Do you have any stress with your partner? We have to ask such questions. Actually, this is very important now. It's very important for mental health, for men, and for the continuity of the family and the health of the family also. So we have to consider that always about the stress that happen with the economic situation, and about the being patient or men stressed by the economic situation or the social situation that we are having, and this effect on the sexual life.
Gentlemen, your thoughts on that? I mean, I think actually, if you talk about it as well, like, Girish, I'll let you continue, but just also put into the context, how difficult has the last 18 months been? Because there's been so much research, and this has been, you know, the pandemic has been powerful in the mental health space for women, of course. And actually, we've seen so much research about how difficult it's been for women in this space, where, you know, not connected to their careers, domestic abuse has gone on the increase. But we don't often talk about the impact that the last 18 months has had on men, and that increasing level of stress amongst men.
Yes, so I can only share my own experience of working with different people during the pandemic and how they presented with their emotional problems. And I have to say that I think the pandemic was something that actually started off this discussion on mental health in a big way. We were not talking about mental health. We were, but then not as much as we did start speaking about it during the pandemic. So that is how the pandemic actually helped. It was a blessing in disguise in a certain sense. And I could see equal number of men coming, not hesitating. So of course, there's a sense of embarrassment, there's a sense of guilt, and there's a sense of shame attached to, oh, I need to seek help because I'm not able to help myself. But this time, the change was that a lot of men were approaching. They were opening up to the idea of, oh, what's wrong with going and talking to someone and see if something is wrong and if someone can help. So this is the difference. Of course, traditionally, we do expect that women are more vocal about feeling emotionally low or any other emotional symptoms that they have. But that's typically expected. Men, they tend to suppress culturally. societally, conditionally, this is how it's expected to be. It's somehow linked to masculinity, as I said before. But I think these stereotypes are changing now. I think a lot of discussion is happening. And as Adil said, that he actually posted that he's going through it. And likewise, a lot of other men openly posted over social media that this is what they're going through. And it just helps if someone else is vocal about it. You don't see that, oh, okay, if someone else is doing it, this is what I'm going through. It's nothing unique. It's nothing different that I'm going through. So what's wrong about me talking about it?
Yeah.
So the pandemic, in a way, not just opened up the discussion on mental health in a bolder manner, but also particularly mental health of men became less of a stigma than before. I'm not saying everything is dealt with. The stigma is still there. It would remain for a long time. We need a big time societal change for those impressions, for those perceptions to change. But at least I can see that there was a beginning, there was a positive start that I noticed during the pandemic with men especially.
I would be keen to see the stats around the suicide rates of men from the beginning of the pandemic, alcohol-related incidents, job losses, and you know, all those kind of things, and how it's affected men from that perspective, because there's a lot for women. But one thing I did notice, I was still working in the corporate world at the beginning of the pandemic, and I did just see that they had a lot more focus, especially my company, on look after your mental health. You know, like this is what you can do. Like just because you're at home doesn't mean that you can work at, you know, first thing 7 o'clock in the morning or 8 o'clock in the morning. Don't check your emails. And I am all for that. So there was that narrative was increasing, and it has been increasing throughout. So it has been, the pandemic has been a catalyst for bringing up and raising the awareness for mental health. But I still feel that there's a huge gap, you know, and men need to catch up. And it's discussions like this where we can be vulnerable even right now, you know, to express what's going on in our lives and how we're feeling about things. Like, what are we stressed about? You know, the stress that I went through that triggered my mental health, my anxiety attack, it was actually me just becoming overwhelmed by, actually, honestly, too many clients were coming forward, which is a great thing, you know? So it might, even that for me sounds a bit trivial to say out loud, but I have to even be true to myself now, is that I was becoming quite busy. I didn't know how to handle it.
Yeah.
You know, and that's what happened. I was working too hard, doing too many things. I felt like I was responsible for everyone, and I didn't know when to stop. So these things creep up on us. And plus, I have a partner. I want to make sure she's okay and look after her. And you know, she's had anxiety attacks in the past too, and it just felt like it was unfair for me to have an anxiety attack when, you know, she's clearly going through a lot, and I want to be there to support her. You know,
I tell you what, if there's any better evidence of like the kind of the stigma and the embarrassment that we have to kind of challenge, is Dr. Moamen's correct points there. He's talking about, you know, a topic that actually goes really straight to the core of manhood, shall we say. And Mrs. Armstrong, if you're watching this video, this is Dr. Moamen, I'm sorry, all right? But, you know, it's something that immediately we're like, oh, no, we can't talk about that. But you're absolutely right. And it's just intrinsically part of kind of who we are and that ability to function. So that is an important thing for us to be able to step up to this line and go, do you know what, we are going to have a conversation about that. So Dr. Moamen, thanks very much for actually raising that, because that's really important. Because it, again, I think speaks to the fact that we can't talk about these things, even though we're supposed to be in a safe space. 2 words I wanted to get your, for me, it seems like 2 of the most unhelpful words around this space are the words man up.
Yeah.
And again, Girish, I'll start with you if I may. Just unpack that whole, you know, when we talk about mental health, and actually mental health first aid training these days, they say basically don't tell people to man up, actually tell them it's all right to not be all right, you know, and actually that, you know, things will pass in time. But right now, telling someone to man up is possibly the worst thing you can do.
Absolutely. This is what I've been saying, that, you know, it starts with how we raise our boys. We always have these prejudices and these stereotypes and these impressions of this is how girls are and this is how boys are. We forget that, you know, whether it's boys or girls, we have emotions, we are humans, certain things are common, but we've segregated, for example, crying to, oh, it being a girl thing. So if a boy cries, the first thing that, even as the boy is growing up, the first thing that he gets to hear is, oh, are you a girl? Stop crying, be a man. or man up, right? So this starts at the root when you're growing up, when your brain is still forming these impressions, when you are forming a personality. And if you get exposed to all of this during that impressionable age, it just becomes a part of you, your personality. And I don't blame anyone that says, oh, man up, be a man. Don't be a sissy, for example. All right, so this is what we get to hear a lot for men who tend to be emotionally, even things like, oh, are you gay? Why are you crying? So, it's very easy for these things to slip out of people's mouth when they see a man being emotionally vulnerable or crying. So I think it all starts with how the man is brought up, the kind of parenting that he gets, this kind of society that he grows up in, what surrounds him, what he absorbs from there, or even the women. So you see, I think if any fundamental change has to happen as a society collectively, this is where the change should start, right from the time where these impressions, these personalities, these stereotypes are being conditioned onto these young minds, so that they don't grow up into becoming men who have learned that it's unmanly to express yourself emotionally. You'd be seen as different, you'd be seen as weak, you'd be seen as very womanly, you'd be seen as not man enough if you cry, or if you just declare that you have anxiety, or if you say that, oh, you're not being able to cope with a certain situation. So just normalizing emotional vulnerability with men, I think that's the way to go, and it should start early on.
Yeah,
I'm sorry to weeper. Having grown up with Nottingham Forest as my football club, I'm used to crying. But Adil, yeah, please, what's your reaction?
It starts with our friends and family, right? It starts wherever we can with our closest people. Is that we should be taking those steps to encourage those kind of conversations. Like I had to go on a bit of a journey with my dad, because my dad used to, he would talk to me as if he wanted me to be stronger, tougher. And he had to, when he was younger and he came over from Pakistan to the UK, he had to be tough. It's a very racist time in the 70s, and he had to do what he had to do. So he wanted me to be tough and strong and not cry. And all. So he only did the best he could with the tools he had and what he knew.
Yeah.
But for so many years, I didn't see it like that. All I saw was a tough dad that wanted me to be something that I wasn't. I was always very sensitive and very in touch with my emotions, and over a lot of time and thinking that I needed to be different, I did suppress them. And what came out were a lot of toxic traits. Now, this is another buzzword going around, toxic masculinity, right? And this is something that I would love to definitely dive into a bit more on this call or another time. But I want to get to a place where I can talk with my friends and we can have a healthy conversation about some deep stuff without it needing to be when you're drunk. It can just be a normal conversation, or without it diverting towards banter or anything like that. But I had to go on a journey with my dad to understand him more deeply. So for me to get over a lot of the things that I felt about my dad, I wanted to understand him, because I felt that there was this disparity between us, and that I never felt like I was enough. This is another reason why men have a lot of pressure on them, is they feel like they're living up to the expectations of their fathers. Another big thing I work with with the men that I'm coaching. Relationship like with your dad, a lot of pressure that they have is actually coming from things like, oh, my dad wants me to be like this, and I just want him to say he's proud of me. So I during the pandemic, me and my dad went on a 5K walk every single day, and I took it as therapy time, and I just asked him questions about his life and what was he like when he was younger. And the more I got to understand about my dad as a child, the more I was more compassionate and had more empathy towards him, because he's just a human at the end of the day, but he did impact me. But I am, it is my responsibility to understand how his words impacted me, and how I can help to understand him better in a way to heal myself, so that I don't feel as stressed or as brought down by the words that he used to say to me. Because when you hear that you're not tough enough, or be stronger, don't cry, all these things, when you're too sensitive, they do have an impact. And a lot of the men I speak to are saying things like, oh, my dad is like this, and I wish he was more like this, and I grew up being scared of my dad, and now I'm like this. There's so links to the way we feel up in our heads and in our hearts that goes back to our parents. So we can end that now by being better.
Well, as I say, like in 68 years, I never got to have that conversation, and I wished I had. we assumed he'd be all right. And it's funny because I always say, like, when I watched my dad fall, I realized that anyone could fall. Moamen, I can see you nodding your head there as well. And if we go back to suicide statistics, I mean, one of the things we're seeing from the UK is that between the ages of 40 and 49, men have the highest suicide rates in the UK. So you were nodding your head there. What was it you wanted to come in and say? Because it's
Actually, initiation is very important for men's health.
Yeah.
Usually, if the men are not complaining or not expressing their problems, so we have to ask them leading questions. The society has to help them. The media has to help them. Just ask them to just initiate the complaint. Just what you feel, express your feeling, and just tell your complaint. This is the initiation. Is very important. Because everybody now is closed on himself, and he is treating his problem himself and not asking for any help from others. So we have to initiate that. Men are very confident and they cannot express themselves. They cannot say, I have problem. They cannot say, I need help. That's why we have to initiate that with them. We have to ask them to express their feelings, their complaint. This is the most important.
How do we get there? I mean, because interesting, if you look back at the UK, at least there is a conversation that is taking place there, both in society and inside workplaces, which is incredibly important. But this part of the world, and not necessarily the UAE specifically, but the Middle East, is much further behind on that journey, shall we say, to having that conversation. It seems I think it feels really important that this part of the world actually begins to have that conversation. We do more of this kind of thing, because there is almost more stigma, perhaps, than there is that exists in the UK and Europe right now.
Yeah, actually the friendship is very important. Groups, group discussion, groups on the social media. This is also can help. Just raising some issues. Like if you feel like some complaint, if you feel something, just express it. This could be a sign for something. This can be leading informations for the men to just express their issues. Actually, during the pandemic, even the friendship, the groups, all this disappeared actually during the pandemic. So everybody closed on himself. Everybody thinking about his issue and trying to solve his issue from himself. But if things open and these groups come back, this will be so much helpful. And now the media is talking about the issues of pandemic, the issues of economic crisis, and all this stuff. If they help the people to solve this problem, so much helpful. Because actually, if the suicidal tendency is very high in the future, it's going to be a very, very big issue.
And another thing, I just want to just jump in. Another thing that we can do is, if we're not able to express our feelings out loud or to anyone, it's to write it down. Journaling is a practice that I brought into my life for the last few years, and it's been something which it's now become a pillar of my life that I do without fail every day, because otherwise these thoughts just go round and round in my head. It's just nice to write things down. And sometimes I don't even look at the book and sometimes I look back and think, wow, I didn't realize I was thinking that, and whether or not I act on it is a completely different story, but just having it out on paper, just having a method of expression. I think that's the key thing, so that we're not going into a coping mechanism. We are just expressing, and then maybe we are able to actually voice them out loud. Even we just send ourselves a voice note, just recording it and saying it out loud, so it doesn't have to go to anyone. It doesn't need to go to anyone. Just you can still express it.
I would completely agree. This is what I encourage all the male clients that I see who find it hard to express, find the right words to just explain what they're going through. I encourage them to write, although journaling is not easy for everyone to do, but then people who've been able to start it and they've seen the benefits of at least getting that outlet and not keeping it all inside. They've seen the change. It can be helpful. It can be therapeutic. So I always encourage this to all my clients, whether men or women, but especially men, because women, they tend to naturally be more expressive with their words. They don't keep much of it inside. It's the men who find it hard to articulate.
You clearly met my wife.
And so journaling, as an advice, just fits well for them.
And Moamen, again, I can see, we've been speaking about this for 30 minutes, and time has absolutely flown by. But how important is it for work? Because workplaces are so much of our lives, that workplaces recognize that there's a real ROI on doing the right thing and encouraging this conversation to take place. Now, obviously, that doesn't mean that employers are responsible for everybody's state of mind and well-being, but they can really, really help in this space.
Yeah, actually, people spending more time in the workplace than their homes, even,
yeah,
or with their friends. That's why the environment in the work must be socially well developed, socially helpful, and they have to help each other. And we can find that a lot of friendship built from colleagues during work, more than that developed outside the workplace. Yeah. So workplace must be socially well developed, socially helpful, and usually I recommend that you're going to have social worker in each big company or in each big place. This is very helpful because they can pick up early any problem. That problem can affect the work, even work production, the worker production, productivity. So it's very important to help people in the work life. And I think the HR, they have to arrange for that. The HR, they are the people who are touching everybody. They are the people who have experience with the background for each body, for each worker. And I think they are the one who can help with that. If any person or any employee has a problem with his life, change in his behavior with his friends, they have to find out how they can help him. Even the colleagues, they have to search for the problem that could develop with any colleague. This is also very important. I think, and could be also some brochures or social media activity or any media activity that can be distributed to the workplaces about the how to pick up early what could happen with the person that can affect his stress level or his mental level.
Adil, thank you for sharing. By the way, everyone, Adil's shared a link to Journaling Made Easy. So thanks for sharing that. It's in the chat. We'll get it into the show notes as well. So anyone that's watching back will be there for you. Adil, I also wanted to come back on that because Arabian business, we often write about, and I often bang on about the ROI of doing the right thing. There's a gazillion amount of research out there that says for every dollar you spend in this space, you'll get $4 back in terms of productivity. You being a men's coach and a motivational speaker and a mindset coach, what's your view on that? Because are you seeing men come out the other side of it being more productive and actually achieving more success than they thought was possible because he actually had the courage to ask a difficult question?
Often it's me asking the difficult questions and then sitting there thinking, what the hell am I doing? Or am I supposed to say? But yes, so I mean, I've had a few clients that have come out and they've started new businesses or restarted businesses, for example. But the key thing that's, stress is an inhibitor of thought and productivity, creativity, all of it. So a lot of time I'm working with the men on just how to bring harmony back into their life, how to harmonize and bring balance. Often it's that they're not focusing on themselves at all. They're not spending any time with themselves. Yeah. And so as we start to just remove a little bit of the baggage, start to give them a bit more time because I can show them that they actually can make time with themselves and for themselves. They naturally come out the other side just feeling happier, lighter, therefore more willing to go and work. They feel more capable of doing work. They feel more energized to work. I work with clients on hacking sleep as well, not just about the mental health aspect, but physical health. How can we get more quality sleep, for example? These things that will impact the way that we think and feel and how we can be more productive the next day. I'm also a personal trainer, so I work with them on how they can get some activity back in their life and how that can help to generate some energy as well. So all of these things work together, but really it's about taking time for yourself. And I find
that's really, 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 really fascinating and interesting. And Dr. Girish, I want to ask about this as well, because I remember when I changed jobs, I actually changed career. I've been a journalist for like 32 years, but a couple of years ago, I stepped outside of that role that I'd done all of my life to do something slightly different, which was in communications. And that ripping off of self-image, I was all over the place emotionally. What I didn't realize was just how much of my identity was linked to my job role, which is not the healthiest to be. And then there's all the other roles that we have. So there's Scott the father, there's Scott the husband, there's Scott the colleague, there's Scott the boss, and then there's Scott the editor. But who's Scott in all of that? And Adil was making a really good point. And I'm probably still on that journey. I've still no idea who Scott was when he was 18, maybe, but who Scott is these days all gets lost in the roles and responsibilities sometimes.
I would agree. And this is something that a lot of men are dealing with, the role transitions, the multiple roles that they're playing. And then, there's so much intermingling where they feel that they're losing themselves. They can't define who they are, what they are. And this is something that I commonly hear from all the men that I meet, whether they see me for a depression or an anxiety or any other mental health problem. But then this is something that plays in the background where, they question the identity, they question the reason for the existence. These existential issues. It's something that all of us do go through from time to time. And then you just try to check of what's going on with you, what have you achieved so far, what did it help you with, what did it made you. So you see, so we do go through these questions time and again, and it's especially when you're going through these transitions that these questions of identity come up. So you relate to yourself as, oh, okay, I'm the CEO of this company, or I'm the father of these 2 children, or I am a dutiful husband, I'm a dutiful parent. So, so it's just that you are all of this, but you are yourself as well in the middle of all of it. And have you ever taken time to see where you stand for yourself, doing everything else that you're doing on the side? I think, as a society, we don't get into these discussions. We don't encourage people to think on these lines. And what it leads to is confusion. You questioning yourself, your identity, where you are, if what you've done so far has been good for you, not good for you, would you have lived your life differently? So we do go through these crisis situations. It could not be a major crisis, but these mini crises do happen with us a lot of times. And that's the time when we just sit down and ponder upon what's happened with us. Have we done things the right way? Do I know where I am and what I've been doing? And it's only valid for us to have these questions, right? Because we don't set out thinking that, oh, okay, so this is how it's going to be. It's only when you reach to a certain point that you look back and you try to introspect of what has happened, of what the impact of things that have happened in your life been on you. How did this shape you? How did this shape you looking at yourself as a person, right? So I think these are pertinent questions that do come up, but then the problem is we don't look for answers because we don't have answers. We try to look for answers ourselves, and then we carry on with life. And eventually, some of these unanswered questions can lead to clinical syndromes like anxiety and depression. And I see a lot of men coming and saying that, oh, we don't know, it's just a midlife crisis. We don't know what has happened. Everything is fine. I have a family. I have a good job. I've saved good money. Everything is fine, but then I still don't feel very satisfied. I don't know what's going on. I have these waves of depression. And this is what needs to be explored.
Yeah, that's because they're not really fine, are they? They are not addressing the things that are really going on. So they might have ticked boxes that they've been prescribed to by society and by their parents. And this again, is the people that I see, the people that I work with, are those that are generally high flyers. They're men that you'd think, oh, they have nothing to complain about, and they actually are depressed. They don't know what they're doing with their lives. They realize that they spent the last 20 years or 15 years doing something that they actually thought would be good for them. And they look for happiness as a destination. It was over there, rather than happiness being inside.
Yeah.
And like you said, come back to identity. Who am I? What do I even stand for? Like, if I take away the job and everything, I don't know what to do. I don't know what I'm even doing with my life anymore. I've just lost I don't know what makes me happy. I like to play this game with the men in my men's group. Introduce yourself without saying where you're from or what job you do. Let's see what.
That's an interesting way to start any conversation. I was going to ask, how do we as men start that conversation with ourselves? That's probably a good, just to stand in front of the mirror and ask yourself that question. Introduce yourself to yourself.
Yeah.
Can you do it?
Peanut butter lover, hummus lover, Harry Potter fanatic, fitness.
That's two aspects of product placement. Other boy wizards are available, but Dr. Moamen, I just another, you've kind of opened the door on some physical sort of manifestations of stress and mental health. You also are very keen on prostate, which again is something that we're really embarrassed to talk about. And I'm just conscious of the time, because literally we could be here for hours and carry on this conversation. But for men of a certain age, me in general, I'm not far off. This is also important for us to be aware of, and almost again have the courage to ask ourselves a question to get checked on that as well. Yes.
Yes. Actually, why prostate cancer? Because prostate cancer, this is the most common cancer in men or age men. It accounts about 19% of all cancer that develop in men, and this is the third cause of death in men after lung and colorectal cancer. So it's common. It's not uncommon. That's why we're encouraging people after 50 to start screening for that prostate cancer to avoid complications, to avoid progression of the disease. And if there is positive family history, we encourage people, there is positive family history for the brother or father, we encourage them to start screening at the age of 45 even. Actually, there is a high risk of prostate cancer development with aging. That means the chance of having prostate cancer in life of the man, it's about 14% probability to have cancer anytime in his life. And the probability to die from prostate cancer is 3.6. So it's still high. And it can be avoided by screening of prostate cancer. It's very simple test for screening. It's a blood test called PSA, prostatic specific antigen, and this is produced by mainly by the prostate, so it's prostate specific. And examination, clinical examination. If there is any positivity for this test, we can proceed for another test to diagnose cancer. Actually, people now, they have a lot of stress about getting cancer in their life, and they need to know how they can avoid that. Actually, for prostate cancer, if we can be fair, there is no so much risk factors except aging, because it's very common after 60, starting after 50. This is the idea. It's starting after 50s usually, and the incidence after 65 of age, it's about 60%. So it's related to aging. That's why we're asking screening for the age of 50. The other risk factor is family history. If there is positive family history, this is another risk. For environmental, diet, lifestyle, it's not so much linked to the prostate cancer, unlike lung cancer, for example, or bladder cancer or other cancers. It's not so much related. But we encourage people to change their lifestyle, to stop smoking, to have balanced diet, healthy diet, to encourage, this is protection against all cancers, all other diseases. But for prostate cancer, there's nothing specific for prostate cancer to prevent it. That's why we're encouraging people to screen it. Yeah.
Thank you for that. And final thoughts, because time is against us. We definitely need to do another one of these panels very soon so we can carry on the conversation. But physically, important to screen. Almost seems like it's almost as important mentally to start screening for men. And Adil, how do we start? Okay, so if anyone's watching today, what's some of the important first steps that they could take?
For the prostate mental, you mean?
No, for mental health.
Mental health.
I'll bring out. Let me bring Adil in first on that one.
Okay.
I want to finish with you, Mo.
Okay.
I'm going to give you the mic drop moment.
Okay. So from a mental health perspective, just to check in with the body first of all. Like, how are you feeling? How are you feeling really in your body? Are you aches and pains, like shoulders, tense, lower back, legs? Like just check in with the body first of all. And also, notice little things about yourself, like, am I going, even if am I going to the bathroom okay? This might sound like it's not linked to mental health, but it's good to just check in physically, first of all. How's my sleep? What are some of the recurring thoughts that I'm having every day? Am I generally happy in the mornings or throughout the day, or am I just lethargic and don't have much to be passionate about or really anything? Like I said earlier, just also check in with yourself by journaling or, writing something down or speaking with your partner or your friends, try to encourage those kind of conversations and notice where you're not lighting up in your life. You know, just notice it. And if you can just notice it and even notice the thoughts that are going on in your head, who's speaking to you? What kind of narrative is going on? You know, is it someone talking to you as if you're, you know, being quite harsh on you? You could have done better today. Why didn't you do this? You messed up that interview, or you didn't quite do too well on that, you know, that project. Who's speaking to you? Notice the narrative in your head. Is he quite a go-getter, or is he quite dismissive or negative? So listening to our thoughts, taking some time, listening to the body, seeing what's going on, venting it either in a voice note to a friend or someone like me who runs like a men's circle, for example, or getting it out on paper. Just find a way to express, but check in with yourself first.
Girish, I'll come to you next. How do we get started on this journey?
Well, but I would like to talk about the more clinical manifestations of how mental illnesses would show. So if there's any obvious change in patterns of behavior, for example, if as a man you find yourself being more aggressive, having more anger outbursts, being more impulsive, getting into risk-taking a lot, which is clearly out of character for you, or you notice that you have persistent sad mood that does not go away. It's not as if, oh, something bad happened, you feel sad about it for 2 days and then you're back to your normal self. So it is a kind of a sadness that persists for 2 weeks, 4 weeks, and you don't see that you're coming out of it. You think that you're losing pleasure and interest in things that you were enjoying before. You see gross changes in your appetite, in your sleep, in your energy levels. All right, so all of these could be signs of depression. Even if you are not very convinced that if it's a depression or if it's just a phase of life, it's always good to go check with a doctor, either a psychologist, a psychiatrist. A lot of people come to me saying that, oh, this is what I'm going through. Is it depression? So it's okay to just go and check. Like if you would have a headache, you just go to the neurologist to check if there's any neurological problem. And if there's nothing, the neurologist just tells you that, no, it's okay. You don't need to worry about it. We couldn't find a cause for it. Likewise, if we don't see that this is clinical depression or needs any further intervention, we reassure the person. So it is not as if going to check would mean that you would be given the label or you would be given the diagnosis. But if you see any of the signs that I just mentioned, it's always good to go and check with a doctor. Make sure that everything is okay before it escalates into a point where it becomes more severe and becomes more difficult to manage. Unusual signs could be thoughts of not wanting to carry on, frank suicidal thoughts. We do have these fleeting suicidal thoughts. Something goes wrong, and you just have a thought that, oh, I'd rather die. I don't want to face the situation. So that's common. But if you see that a thought is holding for too long, and then you're thinking about, oh, I'd rather go to the 21st floor of the building, and why not me jumping off? What would happen? So if you see that these thoughts are more intrusive, if you're thinking more about them, if you see that as something that you might act upon, all of these are red flags. All of these are signs that you need to go check. And this is just depression. I'm not even talking about anxiety. If you see that you're panicking, if you are not able to stop your mind from overthinking, if you are imagining irrational scenarios which wouldn't happen, but then you can't stop thinking that something awful is going to definitely happen. You can't find time to relax. Even if you're on a holiday, you don't feel that, you can sense that relief or that sense of peace. I think all of these are signs that should make you go check with a doctor.
Thank you. I mean, I think that's something we all do a lot, isn't it? Not running through those models of the worst case scenarios over and over and over again at 3 o'clock in the morning when you couldn't possibly, influence the outcome of it. And you can tell yourself this is a waste of energy, but it's really difficult to turn the brain off. So I think that is something that a lot of people with stress need to have a look at, a lot of men with stress. Moamen, I promised you the mic drop moment. How do we get started? And give us some cause for hope, because are we in this place now that, at least more of these conversations are now happening? So we are moving in the right direction.
Yeah, actually, regarding the mental stress or mental health, the first thing that we have to keen about, that we have to keen about others, not only ourselves. I mean, if you have a friend, you can just ask him leading question: how are you doing? Mm-hmm. How do you feel? do you have any problem? This is leading question will encourage him to express himself. We are not care about ourselves only. We have to care about others. This is very, very, very important. Actually, if any friend or any relative has problem, you can find out. You can help him. If you help him, he could help you. And this is the reality of relative friendship or relativity. This is actually regarding our issue about the prostate cancer. I don't like anybody to worry about the prostate cancer. It's very simple screening test, and it's easy to be managed in most of cases. And the survival with the prostate cancer after prostate cancer treatment is very good. So I don't like to. We have good news for that. So I don't like anybody to be stressed about that issue. Just clear your mind. Just do the screening, and you can clear your mind.
Thank you so much. And thank you to Franklin, who sent us a very supportive message. Thank you for that. I'm glad you were here to join us. I found this conversation absolutely fascinating. I think one of the things I take away from this as well is the whole importance of men supporting men. You know, we're here having a conversation about this, so we're at least halfway down the road of being able to have a conversation, but we need to pay this forward into, you know, the lives of our friends and our family. So it is important for us to keep talking, and we need to push ourselves to the front to have these difficult conversations. So keep having those conversations. Adil, Girish, Moamen, thank you so much for joining us on this panel. And also to PRCA as well. Thank you for the opportunity to host this webinar. I think it's an amazing initiative. It's been so, you know, my name's Armstrong, the editor-in-chief of Arabian Business. We have a resilience channel, so we will keep this conversation going. Thank you, everybody.
Thanks, guys.
Thank you. Thank you. Thank you.